Greetings, viewers. Once again, I want to welcome you to another YouTube class. In today's class, we're going to be looking at another nematoparasite that is called Toxocara. Toxocara. So the name is Toxocara. We have Toxocara sp, meaning that we have a various species of this parasite called Toxocara. We have the one that is called Toxocara cati, we have Toxocara canis, and we have Toxocara vitilorum. Cati, canis, and vitilorum. The canis is the species that affects dogs. The cati is a species that affects cats. The vitilorum is a species that affects cattle. So these are the three species of Toxocara. Now, don't forget that Toxocara is one of the nematoparasites that falls under Phasmidia. And I explained that Phasmidia are the group of nematoparasites that are equipped with this sense organ known as the phasmid. The phasmid. The phasmid. So, those that don't have a phasmid are called aphasmidia or adenophoria. Those that have it are called the phasmidia or the sassinentia, and that is where Toxocara fall in. So the phylum is Nematoda, of course. The class is Phasmidia. The order is say Ascaridata. Note that in Ascaris rhombicoides, which we studied the last time, the order is still Ascaridata. So that means that Toxocara and Ascaris are closely related because they have the same order that is called Ascaridata. Then the family is Toxocaridae. Then the genus, of course, is Toxocara with these three species that I've mentioned. But in all these three species, the most common or the representative species is the species we call the Toxocara canis, which of course I said are first what? Dogs. Okay. Now, we have a few characteristics of this parasite, and that's the fact that they have three lips. They have three lips. Most parasites do not have lips at all, especially the members of Adenophoria or Aphasmidia. Then, of course, I've mentioned those that have three lips. For instance, I talked about the presence of three lips in Ascaris umbilicoides, and I'm also mentioning it in the case of Toxocara. So they are equipped with three lips, and they have simple or less specialized oesophagus. That means that they have a kind of oesophagus that is not specialized. And of course, they have certain layers, patterns. They have certain patterns or ridges on the outer most shell of the eggs, or the outer part of the legs of the eggs. You see that they have a kind of patterns, patterns of ridges within them. That's what we call a sculpture. So someone can even see that they have sculptured layers. That means that the eggs are usually sculptured. That means they have certain patterns or a kind of ridges within the outermost part of the legs of the egg. Sorry, and the eggs are usually laid unemprennated. When we say that it is unemprennated, that means that it has not formed the larva. And the infective larva is the LO2 larva. The infective larva is LO2 larva. In the case of Ascaris rhombicoides, don't forget that I mentioned that embryonation takes place within the environment, and it takes a period of 9 to 13 days before this embryonation can be completed. In the case of Toxocara, it takes a period of 5 to 6 days. So you can see that the number of days it takes for embryonation to occur is usually less compared to that of Ascaris lumbricoides. Having said this, I want to mention that even though most people are not familiar with this, but humans are not the definitive host of Toxocara. Humans As a matter of fact, the accidental host, or some people can even call it the paratenic host, but let's use the word accidental host. So, uh, in an accidental host, the parasite gets in and survives. And survives. That does not mean that that host is the main host or the definitive host. And because as humans are not the definitive host, there's something you notice, and that thing is that Toxocara does not grow into maturity in the body of humans. They do not grow into maturity. And because they do not grow into maturity in the body of humans, that means that they do not lay eggs. So it means that in the case of diagnosis, you are not going to see uh, the eggs of Toxocara in the feces of any man. The reason is because they do not grow into maturity in man and they do not lay eggs. So this will lead us to the life cycle. The life cycle of Toxocara begins by the injection of uh, the the eggs with the LO2 larva. And once it is ingested, of course, it hatches within the small intestine of the dog. We're using dog because we said that the representative species is the canis. So once it hatches, the route of migration differs depending on the kind of dog, the age of the dog, and the previous history of infection. In a young puppy without any history of infection, the uh, eggs hatch, and of course, the larvae travel through the liver-lung migration, passing through the respiratory tree, and land in the intestine. That is where they mature into adults. Once they mature into adults, of course, they begin to lay eggs. They begin to lay eggs, and of course, the eggs pass out through the external environment to the feces of the dogs when the dogs, defecate. That is a kind of life cycle that occurs within the puppy, the young dogs. Then, of course, if it's another dog with a history of infection, and because it has a history of such infection, it has developed immunity. So, in this case, now what will now happen is that once the eggs hatch, the larva, goes through uh, the liver lung, but once it gets to the lungs, it stops. It begins to, kind of wander about within the lungs, after which it remains inactive. And it can remain inactive for a long time until when that dog, and I'm talking about the female dog, becomes pregnant. Then there's what we call a hormonal trigger. The hormones go to trigger these larvae, and once they are triggered, of course, they are reactivated again in such a way that they join circulation and they find themselves within the placenta. And from the placenta, the adult dog can now transfer it to the uh, the 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 young dog or the puppy which it is carrying. So what I'm saying in essence is that through the placenta, the young dog can become infected, or the fetus of the dog can kind of become infected. So that is through the placenta. As a matter of fact, this is what we call transplacental transmission. Mm? Transplacental transmission. Then, okay, I've mentioned these two. Okay, the other way is through the injection of, okay, I've mentioned these two. So have various method or means of transmission. We have transplant center. Then, of course, we have through the injection of eggs, which I've mentioned. Then, of course, colostral method. That means through the mammary gland. The young puppy can also uh, get infected through sucking of the breast milk of the mother. Another way, another method of transmission, remember I've been talking about different methods of transmission, is through the injection of the uh, the paratenic hose or the transport hose. So once the paratenic hose or the transport hose is ingested, then the person can become infected. And the paratenic host in this case uh, are chicken and mice. So man can also get infected through the ingestion of the paratenic host. But don't forget that I said man is not the definitive host. Man is the accidental host. So the parasite does not grow into maturity in man. So that's it about the life cycle. Then coming to the epidemiology. In the case of epidemiology, discover that we have factors. Use of dogs as pets and the use of dogs and cats as pets can help to spread the disease. Some people do that. They use their dogs and pets, and of course, they litter the environment with feces. And these feces contain the S of Toxocara. And of course, we'll have children that crawl and walk within the environment using their hands to play. And at the end, they also put the same hands in their mouths. Then children can get infected through this method. And I've mentioned the transport hose. The transport hose, when ingested, can also serve as a means of infection. Treatment is through the use of mebendazole. Mebendazole is a popular drug that is used for the treatment of most nematode diseases. So it can also be used or applied in this case. Prevention and control. Stop using uh, dogs and cats as pets at home. But if you must use it, then it should be under the guidance of a veterinary doctor who will assess the health of the dog and probably make sure that the dog is dewormed every 2 weeks or every month, depending on what he subscribes to. So once this thing is done, that means that the dog is being taken care of. Then of course it can be used as a pet. Then of course children should be prevented from playing in the ground, in the soil that is seeded with the S of Toxocara. Diagnosis is through the demonstration of the presence of S in a fecal sample. Remember, this is tricky. This diagnosis I've mentioned now is for dogs. It's for dogs, or probably cats and probably cattle that are the definitive host, because you cannot see the S of a Toxocara in the feces of man, since man is not the definitive host. So the parasite does not grow into adults in man, does not mature into adult in man, and because of that, does not lay eggs in man. So serological test is a method that can be used to diagnose this disease in man. Then pathology. The parasite can cause what we call uh, visceral larva migrants. So there's what we call random larva migrants. So those larvae that migrate from one part of the body to the other, they're called random larva migrants, and they can cause a disease entity known as a visceral larva migrant, because they cause damage to some of these organs. Sometimes they migrate to the lungs, the liver, the heart, the brain. They can cause damage to these organs or these structures. That is what we call that disease entity or disease condition is called the visceral larva migrants. Then they can also migrate towards the eye and cause granulomas of the retina. They cause inflammation of the retina, destroy the retina, resulting to permanent blindness. Then, of course, we'll have hepatomegaly. Hepatomegaly, as a matter of fact, the organ that is most affected when it comes to toxocariasis is the liver, and the inflammation of the liver is called hepatomegaly. With liver cirrhosis, that means scarring, having some kind of scars or scars on the liver. That's an advanced stage of liver disease, starting from the fibrosis here, it advanced into liver cirrhosis. So these are some of the pathological effects of Toxocara uh, SP. So that is where I will stop. Help share this video to all the medical students around the world that offering parasology. It will be of great importance to them. I still remain Dr. Anokujo Onuchenna. See you in my next class.